we're going to talk about your reducing properties of your carbohydrates. And so that is on your activity 12. Okay, and so let's take a look at that one. Okay, and so your reducing property of your sugar, and so that is accordingly important for the identification of the different types of sugars in their properties. Okay, and so also, and so that is important. Your detection of your reducing sugars in your food products is important for quality control and safety purposes. Accordingly, and so your reducing sugar content indicates the quality of the product. And then also, ayan, so your reducing sugars generate diverse products and so that are beneficial for health and others are toxic and even carcinogenic. And your reducing sugars are used to diagnose diabetes accordingly. And so that is your reducing property of your sugar. So let's take a look at your reducing sugar. Okay, and so your reducing sugars are in a sugar that can act as a reducing agent because it has a free aldehyde or a free ketone group. And so they are, or your reducing sugar are any carbohydrate having free aldehyde or ketone functional group. Okay, and so in this case, and so your molecule is reduced when electrons are gained and oxidized when electrons are lost. And so in this case, and so your aldehydes are oxidized to your carboxylic acid. Or with this, and so or your aldose, these sugars that contain your aldehydes are oxidized to your carboxylic acid, no? And then the copper hydroxide from your reagent, actually from the copper hydroxide from your reagent is reduced to your copper oxide. Okay, and so there is a gain and loss of electrons for the two. Okay, and so that is for your reducing sugar. Reducing property of your sugar. Okay, and so let's take a look at your reducing power of your sugar. Okay, and so accordingly, all monosaccharides and disaccharides that contains your free aldehyde. And so again, you have your free aldehyde or ketone group possess a reducing property. And so what is this reducing property? And so they reduce your alkaline metals. These sugars reduce your alkaline metals and are themselves transformed into organic acids. Okay, and so you have here the solutions most commonly employed for your for testing the reducing property of your sugar are actually alkaline solutions of copper sulfate. And so alkaline solutions of copper sulfate, like in your test for, like your Felling's test, sorry, your Benedict's test, and your Barfold's test. And so among them. Okay, and so also, and so you use your alkaline solution of your bismuth. And so using your bismuth subnitrate, alkaline solution of your bismuth subnitrate in your Nylander's test. Okay, and so for this, your alkaline solution of your copper sulfate, when heated with a reducing sugar, forms a yellow to brick red precipitate. Okay, and so in the presence of your reducing sugar in the solution. And so when heated, ayan, so it will yield a brick red precipitate. Okay, and so your cupric hydroxide, this one is blue. And so you have your copper 2 for this. And so it's reduced into your copper oxide, copper ions only. And so to give you your red color, okay? And so you have your cupric hydroxide is reduced to your cuprous oxide to give you a red color here, okay? And so in case for your Nylanders or you're using your bismuth subnitrate, ayan, so your the bismuth hydroxide formed, ayan, so the bismuth hydroxide formed is reduced to black metallic bismuth. Ayan, so that is in your Nylander's test. Ayan, so in your alkaline bismuth subnitrate, the reagent used in your Nylander's test, ayan, so your bismuth hydroxide formed is reduced into your metallic bismuth in the presence of your reducing sugar, giving you a black precipitates. Also, and so some organic acids, and so when in alkaline solution are also reduced. And so examples of this, your picric acid, your yellow picric acid is reduced to your picramic acid. Okay, and so your yellow picric acid in the presence of reducing sugar is reduced to your picramic acid. Your picramic acid here, this one is a red color. Okay, and so that is for your reducing property of your sugar. Okay, and so let's take a look at your Fellings test. Okay, and so your Fellings test, and so it uses your Fellings A and Fellings B reagent. Your Fellings A here is a deep blue color. It has a deep blue color due to the presence of your hydrous copper. And so for this, and so your copper sulfate is present in your Fellings A, and so that will serve as the oxidizing agent. Your Fellings B, and so that is it is colorless and it has your Rochelle salt or your potassium tartrate with sodium hydroxide. And so this Fellings B or your potassium sodium tartrate prevents the precipitation of your copper. And so before testing your Fellings test, and so you should mix first. You before testing your sugar using your Fellings test, and so you should mix first. You should have a freshly prepared Fellings mixture. You have your Fellings A and Fellings B, and so it should be freshly prepared. Okay, and so in the presence of reducing sugar, and so it will reduce the copper 2 ions into your copper, and so that is your copper oxide, and so giving you a red brown precipitate. Okay, and so in the presence of reducing sugar, ayan, so with the copper is reduced, the copper 2 ions are reduced into your copper oxide, giving you a red brown precipitate. Okay, and so the reagent should be prepared right before you test using your Fellings test. Okay, and so all your monosaccharides will test positive for your Fellings test. Your sucrose will give a negative result for this test. And so your lactose and your maltose accordingly will give a positive result also for your Fellings test. Again, but your sucrose will not give a positive result, and so it will give a negative result, your sucrose. Okay, and so that is for your Fellings test. Let's take a look at your Benedict's test. And so you have your Benedict's test here, and so it uses your Benedict's reagent, your copper sulfate, and so sodium citrate and sodium carbonate in an alkaline solution. Okay, and so also just like with your Fellings test, and so in the presence of your reducing sugar, and so your copper is reduced by your reducing sugar to produce your copper ions. Okay, and so your copper 2 ions are actually reduced in the presence of your reducing sugar to produce your copper ions or your copper oxide. Okay, and so giving you a brick red precipitate. And so giving you a brick red precipitate for this. Accordingly, and so the intensity of the color corresponds to the amount of reducing sugar present in the solution. Okay, and so that is for your Benedict's test. Again, and so it uses your copper sulfate, your sodium citrate, and sodium carbonate in alkaline solution. Okay, and so this one, your Benedict's test, and so the reagent for your Benedict's used in your Benedict's test or your Benedict's reagent can be stored, and so can be stored. And so unlike for your Fellings test, and so the reagent should be freshly prepared. Okay, and one advantage for this one accordingly is the reading for your Benedict's test is can be done semi-quantitatively. Ayan, so that is based on your intensity of the color. Okay, and so let's take a look at that. And so you have here your green color. And so if you have a green color, then you have it as positive. Ayan, so positive but weak. And so that is +1. Okay, and so a green precipitate, and so will give you a 2 plus grading. And so a yellow precipitate will give you a 3 plus grading. And then your orange precipitate will give you a 4 plus precipitate. And then a brick red precipitate will give you a 5 plus reading. Okay, and so that is for your Benedict's test. Again, a green color will give you a 1 plus. Your green precipitate will give you 2 plus. And so for the Ayan, so for the grading, and then 3 plus for your yellow precipitate, and so 4 plus for orange precipitates, and then 5 plus for brick red precipitate. And so accordingly, that is the grading for your Benedict's test. Okay? And so you have here your reducing sugars, all your monosaccharides again will test positive for this, and then your sucrose again will test negative for this. Okay, and so and of course your polysaccharide and your starch, and so those items will give a negative result for this. Okay, and so that is for your Benedict's test. Have here your Barfold's test. And so your Barfold's test. And so it utilizes your Barfold's reagent. And so that is your copper ions in acetic acid. Okay, and so your Barfold's test. And so it utilizes your copper ions in acetic acid. Okay, and so in the presence of your reducing monosaccharides, and so they are oxidized to your carboxylic acid, and a reddish precipitate of copper oxide is formed. And so you're reducing in the presence again of your reducing monosaccharides, and so they are oxidized to your carboxylic acid, and a reddish precipitate of copper oxide is formed to give you a red precipitate. And so that is for your Barfold's test. And so this one is a test to distinguish between your reducing monosaccharides and you're reducing disaccharides. Okay, and so this one will give a positive result for your reducing monosaccharides. And so it will give a positive result for your reducing monosaccharides. Okay, and so accordingly, and so your reducing disaccharides will give a slower reaction for this. And so that is why this is a specific test accordingly for your monosaccharides. Okay, so let's take a look at your tolerance test or your silver mirror test. And so it utilizes your tolerance reagent that is made up of your silver nitrate, your potassium hydroxide, and ammonia. Okay, and so for this, and so your tolerance reagent oxidizes your aldehyde and precipitates the silver accordingly. And so your aldehyde is oxidized into your carboxylic acid. Okay, and so your aldehyde is oxidized to your carboxylic acid. Okay, and so your silver ion is reduced to a silver metal which deposits as a thin film on the inner surface of your glass. Again, in the presence of your oxidized aldehyde, and so your silver ion is reduced to silver metal, which deposits as a thin film on the inner surface of the glass. Okay, and so your aldehydes give a gray-black precipitate or a silver mirror. Okay, and so for this, and so your in the presence again of your oxidized aldehyde, it will reduce your silver ion to your silver metal. And so giving you a positive result of silver mirror. Okay, and so this one, your tolerance test is specific to your aldoses. And so this tolerance test is specific to your aldoses. And so your ketose sugars will give a negative result for your tolerance test. And so it will give a negative result to your tolerance test. Okay, and so again, the positive result for this is your silver mirror. Okay, and so please don't confuse your tolerance test with your tolerance chloroglucinol test. Ayan, so please don't confuse your tolerance test with your tolerance chloroglucinol test. And so your tolerance chloroglucinol test is a test for your galactose. And so And that is a test for your galactose. A red precipitate is the positive result for your tolerance chloroglucinol test. And so again, please don't confuse your tolerance test or your silver mirror test with your tolerance chloroglucinol test. Okay? So all your monosaccharides are reducing sugar. Okay? And so like you have your fructose, your glucose, and the rest of your monosaccharides. And again, all of them, all of your monosaccharides are reducing sugars. And so you have your reducing disaccharides here. You have your maltose, your lactose, and your cellobiose. Okay, and so your sucrose, and so that is what they call this, a disaccharide, and so that is not a reducing sugar. And so it is not a reducing sugar because it does not contain a free aldehyde or ketone group. Though your sucrose is made up of your fructose and glucose, but then it does not have a free aldehyde or ketone group. And so to possess a reducing property. Okay, and so also your trehalose, that is a disaccharide, and so they are the your sucrose and trehalose, they are a disaccharide that does not reduce, that do not possess a reducing property. Okay, and so others, you have your glycogen, your starch, your and the rest of your polysaccharides, accordingly they are not reducing sugars. Okay, and so they do not possess your reducing property. Okay. Okay, and so let's take a look at your hyperglycemia. And so this one actually, your hyperglycemia actually is an increase in blood sugar levels. And so, or blood glucose levels. And so that is your increase in blood sugar levels or your blood glucose levels. Kasi the sugar that is being detected in your blood actually is your glucose. And so please don't be confused with that, no? And so this one, your hyperglycemia, and so accordingly, and so is the common effect of uncontrolled diabetes. And so that is the most common effect of your uncontrolled diabetes. Okay, and so this one is caused by a hormone imbalance, by a hormonal imbalance. Okay, and so let's take a look at this one in healthy patients. And so if you are healthy in healthy patients, during a hyperglycemic state, in your hyperglycemia state, and so your insulin is secreted by your beta cells of the pancreatic islets of Langerhans. And so your insulin is secreted by the beta cells of your islets of Langerhans of your pancreas. And so what does your insulin do? Ayan, so your insulin will enhance the membrane permeability to you to cells in the liver, muscle, and adipose tissue. And so your insulin enhances membrane permeability of cells in the liver, muscle, and adipose tissue. Also, it alters the glucose metabolic pathways accordingly. And so that is again, and so it promotes your entry of glucose into your cells. And so that is for the function of your insulin. And so when are you going to tell that someone has a hyperglycemia? And so in cases of your in fasting blood sugar, and so you have a what you call this, a range of a normal, a reference range, or your normal range of 70 to 100 milligrams per DL. Okay, and so this is your reference range. Okay, and so if you have again in your fasting blood sugar, and so if that is greater than 100, then you can call it as hyperglycemia. And so in case naman of your random blood sugar, a blood sugar of greater than 200 milligrams per DL, that is accordingly hyperglycemic. And so that is accordingly hyperglycemic. Okay, and so that is in case of your random blood sugar. Okay, and so again, and so your hyperglycemia is the common effect of your uncontrolled diabetes. Okay, your diabetes mellitus. Okay, and so your diabetes mellitus. Ayan, so this is an endocrine disorder. And so the pancreas does not produce enough insulin, or when the body cannot effectively use the insulin it produces. And so for this, and so there is, do you have your impaired production and impaired utilization of your insulin. And so you have your impaired production and impaired utilization of insulin. Okay, and so either, and so there is very low insulin produced, or you have enough insulin naman, but then, and so you have probably problems with the receptors for your insulin. Okay, and so those items. Okay, and so you have your most common signs and symptoms of your diabetes mellitus. Okay, and so you have your feeling very thirsty, or this one is your polydipsia. Okay, and so needing to urinate more often than usual, and so, or you have it as your polyuria, your blurred vision, you're feeling very tired and losing weight unintentionally. And so I suppose you are familiar with your classic, actually, that is your classic signs and symptoms of your diabetes mellitus. You have there your four P's. You have your polyphagia, polydipsia, your polyuria, and your prolonged wound healing. Okay, accordingly, and so when not controlled, and so it can damage the blood vessels in your heart, in your eyes, kidneys, and nerves. And so it also your what you call this, it can damage your nerves in your nerves and blood vessels in your feet accordingly. And so if you have a damaged blood vessels in your eyes, then it can cause permanent vision or blindness. And so if you have in your kidneys, and so it can cause kidney failure naman. And so it will damage your nephrons, giving your kidney failure. And so problems with feet from your nerve damage, and so from your problems in the feet from nerve damage, and so due to your nerve damage and poor blood flow will cause foot ulcers, and so and may lead to amputation. Okay, and so that is for your diabetes mellitus.